to go along with Medicare options. So I'm going to let them start. Just a little housekeeping issue. If you would like some coffee or tea or Danish or watermelon, help yourself. And the bathrooms are right over here to the right if you aren't familiar with the building. Okay? Thank you.
Thank you. Thank you. Good morning. I am Mary Messy, the Regional Director for the SHINE program, and Tracy Benson is our assistant, and our office is located at the Middleborough Senior Center. We cover Plymouth County and the New Bedford area. And of course, this time of year is open enrollment from October 15th through December 7th. This is the time of year that you can change your plan. Whether you have an Advantage plan or just a Part D plan, which is your prescription plan, this is the time of year you want to have that checked. What happens is every year, everything changes. Nothing stays the same. And I know there's one thing that everyone is probably concerned about, because I hear about it everywhere we go, is your Part B premium.
Yeah.
$104.90. If you're already receiving Medicare, that's not going to change. Don't worry about it. If you're new to Medicare next year, yes, it is going to change. It will be higher. We don't know what it is. We haven't been told yet, but it is going to go up. But yours won't. If you're already receiving the paying the $104.90, that's going to be the same for next year. So that's a good thing. That's good news, sort of, because you don't get an increase. So that's not so good. But think about it. If you got an increase, that would have gone up too. So anyway, we'll get started. Everyone has a packet. Color coordinated, you'll notice. It's all colors. I'm going to do the left side of the page, and Tracy's going to do the right side of the page. Because when you get Medicare, Medicare isn't 100% coverage. And what you want to do is you want to see a SHINE counselor, which you have 2 SHINE counselors here. You have Wendy. Where did she go?
She went back to her.
Fran. Thanks, Marvin. Sorry, Fran. So if you need any help, you can always make an appointment with either one of the girls, and they can sit down with you. But I want you to know you have SHINE counselors here. All right, Medicare. You get Medicare because you're either turning 65, or maybe you're still working and can defer and pick it up when you decide to retire. Or you could be disabled for 24 months, under 65, and if you've been disabled for 24 months, you're going to receive Medicare that way too. And once you get your Medicare all in place, you want to get on the phone and call the SHINE counselor, because we're going to sit down and we're going to give you all your options. We don't sell anything, we just give you all your options, and it's free. So let's get started with the left side of the page. You see the green boxes, A and B. So if we turn the page, that green sheet is going to tell you all about Part A and Part B. So we'll look at Part A first. Part A is your hospital coverage, and Part A is free for most of us. Part A also has a deductible, and now this is your hospital coverage. If you were to go to the hospital for inpatient care, okay, and you had just Medicare, you're going to be responsible for $1,260. Now these figures are for this year, for 2015. We do not have the figures for 2016 yet. But it's based on days, benefit days. So if you go into the hospital, let's say in January, and you're there for 2 weeks, okay, now this is someone who has just Medicare, no other coverage. You're going to be responsible for that $1,260.
Day.
No, not a day.
Oh, okay.
If you are in there days 1 through 60, you're going to pay that one deductible of $1,260.
All right.
You come home from the hospital 2 weeks later, and you don't go back to the hospital till, say, September. You'll be responsible for that $1,260 again. Because if you're home for 60 consecutive days after being inpatient, you're gonna be paying that again. Be responsible for that $12.60 again. So that could happen more than once a year. And you'd be surprised how many people that are still out there that have just Medicare and no other coverage. After that, if you were in for, say, 60 days, which that doesn't really happen that often anymore, thank goodness, days 61 through 90 would be $315 a day, and so on. The other most important thing about Part A is your skilled nursing facility. That's rehabilitation. So if you went and had surgery and then you needed rehab and they sent you for rehabilitation, to a skilled nursing facility, the Part A of your Medicare is going to pay the first 20 days. So that's good. That's good news. Days 1 through 20, Part A is going to take care of that. If you're there longer than 20 days, you're going to be responsible for $157.50 a day. So that could add up. And I won't go on and read the rest of the green sheet to you. It's you can do that, but these two things are the most important that you need to know about when you have Medicare and how Part A works. Any questions on Part A? So if we turn the page over, we'll look at Part B. Part B is your medical coverage. And Part B is what you pay for. That's where your $104.90 goes every month. Okay? And now Part B, being your medical coverage, it's not 100% coverage either. And it also has a deductible. And the deductible is $147. But it's a one-time, it's an annual deductible. So the first time you go to see either your physician or a specialist, or if you go for x-rays, you're going to be responsible for that first $147, okay, that one time. After that, the Medicare Part B is going to cover 80% of all your medical needs. And when you think about it, for $104.90 a month, if you stay out of the hospital, that's really not bad to get 80% of your coverage paid for. That's really, as long as you're just going to the doctors or having little tests here and there. But you wouldn't want to have an MRI and have to pay 20% of that. So that's how your Part B works. It does have that $147 deductible. And after that, it only covers 80% of all your medical needs. Any questions?
What does an MRI cost roughly?
I have no idea. I think it depends on what they're looking for. I have no idea. I'm sure it's thousands. I'm sure it's thousands.
Thousands of dollars.
It could be thousands of dollars.
I don't know what I'm talking about.
So now that you have your Medicare card, and do you all realize or know that you don't get your Medicare card from Medicare? You go to Social Security. Almost doesn't make sense, but you go to Social Security to get your Medicare card. That's where you would either call or you can go online. We have a great website that you can use. So now that we have Part A and Part B, does not cover any prescriptions. Medicare does not have a prescription plan. It's not a prescription plan. So as you'll see, the next box down says Part D, because we're going to talk about Part D prescription coverage. First, I'm going to tell you where not to get a Part D plan. You do not get a Part D plan from the wonderful commercials they have on TV, because they're not giving you all the information. You don't get one because your best friend likes theirs, or your neighbor, or any family member, because your medications are different than theirs. Very seldom will you find two people with the exact same medications. And there's 26 plans to choose from next year. And with these 26 plans, some of them have deductibles. And these are the great commercials you see on TV. $18 and, or it's free. There's something more. They're looking for more money out of that because nothing's going to be free. But a lot of those prescription plans have a deductible of $360. What happens if you have a plan that has a deductible like that, is when you go to the pharmacy for the first time in the year to get your medications, and your plan has a deductible, you're gonna be paying the full amount of your medications until you've spent $360. And then after that, it would be your co-payments. The deductibles vary between the plans. Some only have a $125 deductible or a $150 deductible. Some of the plans don't have a deductible. You may pay a little more in a premium, but because of the deductible, you may pay less in a premium. So what we want to do also is you don't pick a plan, like I said, because it has a great commercial on TV or from a friend or a neighbor. You want to see a shine counselor, because what we do is we take a list of your medications, we put it through a formulary on Medicare.gov with some of your information. You need to know what pharmacy you use, because what happens with these 26 plans, they have contracts with pharmacies. So when you get a prescription plan, we want to make sure the pharmacy you use has a contract, because in many cases, your tier 1 or tier 2 drugs would be zero cost to you. So you might find too, when you're sitting with a shine counselor, and the plan that is best for you may not have a contract with the pharmacy that you use. So we'll say to you, you know what? If you don't mind going, so let's say you go to Rite Aid. You don't mind going to Walgreens. If you go to Walgreens, your tier 1 and 2 drugs are free, because this particular plan has some sort of contract with them. So this is what we look for when we're sitting with our clients, because we want to make sure that out of these 26 plans, you're getting the plan that has that contract with that pharmacy, so that you're paying as little as possible. Another thing that these plans do is they change every year. They change their formularies. And these plans don't all cover the same medication. You could be on a medication this year, isn't it crazy? You could be on a medication this year with your plan, and in January, when you go to pick up that medication, it may not be on their formulary anymore.
Yeah.
But that's what happens. So that's why it's important to have your plans looked at. Yes?
If you're on a particular plan,
Mhm.
when in the year can you change it?
During open enrollment, between October 15th and December 7th, and then that would become effective for January 1st. Okay?
So between now.
Now and December 7th is
December
when you
7th.
want to get that plan looked at.
For 11 days.
Mm-hmm, that's right. Yes,
Do they have to notify you that your medication is now going to be out of the plan?
I don't believe that they do. I think what they do is they might send you a book
Yeah.
with all that they cover.
They do.
Seen the book.
Right, but see, when we input your medications, we'll also see the plan that you presently have. So we can take that plan and compare it with another plan, and it will tell us exactly what your meds are, whether it's a tier 1, 2, 3, 4, or 5,
That's right.
and we can see what your plan's gonna be doing next year.
You're right.
Yes,
I take eye drop, the bottle's that big, $95 a month. But I said, I can't afford it. So my doctor wrote and said, you've got to give it to her. Last year, they gave it to me for $35. This year, it's $45, but still, it's a lot better
it's
than
still a lot better than
Yeah.
95,
Yeah.
correct, yes.
Well, like the plan we have, as an example, the plan we have, the premium went up $17 a month per person
Yeah.
for next year.
Exactly.
Now, it's a great plan, but bottom line is.
That's a lot of money.
It is a lot of money.
Yeah.
So that's another reason you need to have that checked, because it's very possible that there may be another plan with a lesser premium that would cover your meds. Not always 100% of the time, but many times.
And like you say, the big thing is they change the formulary
Yeah.
every time you turn around.
They do. And there's so many people out there that don't realize, just give us a call. Many times we do it right over the phone. I do a lot of the searches right over the phone. Yes.
I have an HMO, okay,
Mhm.
and that covers your pharmacy.
Correct.
But the others don't. You know, so you have to find, and that's separate. You have to get a separate pharmacy, you know, for your medicines. So that
And again, with those HMOs and PPOs, you wanna be absolutely sure that your medications are covered.
Yes,
Under those
yeah,
plans also,
yeah.
because they also change.
Yeah, because when you get into that, it's not generic, you get into that tier 3, you have, first time I just recently bought my pills, because it was $200 plus $245, that's a lot of money.
That's a lot of money, yeah.
You know?
Yeah, and we do the best that we can to
Yes.
try to save you money.
Right.
On the average, we save people about $300-400.
Yes.
Last year, it was like $300-400. I mean, sometimes we save them thousands
Right.
because they may be taking a lot of, say, inhalers, and they might be covered this year, but they're not gonna be covered next year. That's why it's important to have it all looked at.
Because my insurance went up $22.
Yep, they do, and it's hard when that happens, so. All right, so now I've given you your Medicare card, that's your red, white, and blue card,
Yeah.
and you have your prescription card, you have your plan that contracts with your pharmacy, and you're all set to go there. But remember those gaps in Medicare, that $1,260, that $147, and that 20%? That's still out-of-pocket cost. So let's look at Medigaps. It's the white page with the blue stripe on the top. Okay? And many of you here might have a Medigap plan. Okay? Now, you'll notice, if you go right there, you count them all, there's 8 plans. The one on the bottom, the Medic's Choice, isn't real popular in this area, so we don't talk about that a lot. You don't want anybody to get too confused. You can always call Blue Cross yourself and ask them about that plan. So out of those other 7 plans, if you go across, you'll notice there's a Supplement Core and a Supplement 1. Let's look at the Supplement Core plans. Out of those 7 plans, which one is the most expensive? Humana. $143.26, that's a lot of money. Which one's the least expensive?
Blue Cross.
Blue Cross Blue Shield, correct. Now, these Medigap plans have the same exact coverage. One plan is not any better than the other for coverage, they're exactly the same. The only thing that's different is what you're gonna pay every month.
Blue Cross went up $29 a quarter per person.
Yeah, that's what I need.
But that is still the least expensive plan.
Amen.
Yeah.
Amen.
And I have great luck.
Okay. So
I
there was
wouldn't
one,
change that.
No,
Yeah.
definitely not.
so what these plans do is they follow Medicare. Medicare is gonna be your primary insurance, okay? And Medicare is nationwide. You can go anywhere with your Medicare card. It's not just Massachusetts. You can go anywhere with your Medicare card. And what these Medigap plans do is they follow. So if you go south for the winter, these Medigaps will go with you. You don't have to worry about coverage. Okay? So now, we're looking at that core plan for $93.70. We turn this page over, it's going to explain how that plan covers, how it works. The first column is the benefit, and we've already gone over that, Part A and Part B, with our green sheet. And where the second column is cost for beneficiary with original Medicare. We've already gone through that on our green sheet, okay? The next one, cost for beneficiary with supplement 4. So that's $93.70 a month, okay? If you were to have an inpatient stay, you are going to be responsible for that 1,260 days. So that core plan, you can see, does not cover the hospital, inpatient hospital stay. If we go down to the skilled nursing, remember I said the first 20 days covers your rehab After that, you're responsible for $157.50 a day. It's the same with the court, you choose the court. So you don't get any extra coverage on that. And if we look at the Part B, the annual deductible, you're still gonna have to pay that if you have the core plan. But after that, you see that zero, nothing. Because that's what the core plan does. It pays the 20% that the core plan or Medicare doesn't cover. Okay, so it will, that core plan is gonna pay 20%. So if you stay out of the hospital, you just go to the doctor's once or twice, once you spend $147, you're gonna pay the rest. It's not a bad deal, right? It's good. It's good if you don't use it that often, stay out of the hospital. So now let's go back to the other side, and it'll show you the supplement 1. That's the third column over. Again, what's the most expensive plan there? Humana again. And the least expensive? Blue Cross. Again.
Why would anyone pick, if there's no difference, why would anyone pick something else?
Because that's their choice. And we do have some people that do. I have had clients come in and through their employment, they've always had, let's say, Harvard Pilgrim.
Yeah.
They want to stay with Harvard Pilgrim. They know that they can pay less for the same coverage, but Harvard Pilgrim is who they want to be, and they can. It's your choice. So, a lot of people do choose United Healthcare because they're an AARP member and they just want to be loyal. But why pay more than you have to for the same coverage is what I look at, so. Anyway, all right.
And this is the core coverage
Yeah,
of Blue Cross. I mean, you could have bronze.
Now we're going to talk about bronze.
Okay, which is, okay.
Yep. So that supplement 1, the least expensive is Blue Cross. It also is called bronze. A lot of people have that. So $186.56 a month. That's all you pay every month if you can afford it. No other out-of-pocket costs. Go anywhere. It follows your Medicare. It pays 100% of all your Medicare costs. So if you turn that over and you look at that last column where it says cost per beneficiary with supplement 1, what do you see all down that line, that row? Zeros, because that's what it's going to cost you. It's going to cover that Part A inpatient of $1,260. It's going to cover your rehab, days 21 to 100. And it's going to pay for that $147 deductible on the B side, and all of the 20%. It's expensive, but if you can afford it, it's a great plan. If you are someone that has a lot of health issues, this is going to save you a lot of out-of-pocket costs. Because all you have to do is just pay that one premium, and you can go to any doctor, any hospital, any specialist. If you're having treatments or whatever all the time, you know, this is going to help you with that.
That doesn't come.
It's $186. $186.56. These are next year's figures.
So that 186
Doesn't cover.
covers everything?
No, not the medications.
Not your medication,
Okay, but it
because that's
covers
separate.
everything else.
On the on the medical
You
side.
have to get a separate.
And that's Blue Cross Blue Shield. is
Yeah.
the
Any
186.
one of them will do that,
Yeah.
but Blue Cross is the least expensive.
And do you have to go, you have to be like in network?
No networks.
No networks.
No
You go to
networks with
anybody
these
who wants.
plans. Anybody who wants. You're in charge. Yes.
One of these six cover dental.
No.
Wow.
Well, they do offer dental. They offer a separate dental plan. If you look,
You need a lawyer.
I need a lawyer?
No,
Oh, you
we
need a lawyer?
lawyer.
You, whatever you have for a plan, call them and ask them, do you have a dental plan? If they don't, you can give us a call, or when you call, we have a list of different companies that you can call to see what, which might be best for you. We, as Shining Counselors, do not get into the dental, the vision, and the hearing. It's a whole lot of extra for us, and there's so many differences between what, the plans that they offer, that you're better off doing it yourself.
They do have dental.
Yes.
They do have dental.
Yes, they do,
Separate.
but it's a separate rider.
That's right.
Yes.
They have hearing.
Well,
So,
can we just touch on that dental for a second? So I noticed it on the one, across Blue Cross Blue Shield, it says $575. So would it only be $575 a month for the dental?
oh, hold it, where do you see 575?
Oh, yeah, it's just no premiums.
It's vision and hearing.
Oh, yes,
Dental vision, yeah.
I see.
It's only $575 a month. I was just
Are there any other questions on the Medigap?
That might be do with just cleaning.
Yeah, they're all different.
It might be just cleaning.
They're all
Yeah.
So if we go back to the front page, I gave you a Medicare card, I gave you a prescription plan, and I gave you a Medigap plan, whether you took a core or a supplement one. So, and that is one of the reasons we passed these out, so you pulled all your cards. That's, hold your insurance card, or your Medicare card, whatever. So I've done the left side of the page, and now I'm gonna let Tracy do the right side. So if you are confused now, you will be using more confusion when we're done. Okay?
Okay. So what Mary talked about was, as a Medicare beneficiary, you electing to actually use the Medicare as your primary insurance. And the ability, and to do that, like she said, it gives you a whole nationwide network of physicians. So a lot of people like that freedom and flexibility to kind of go where they want to go without having to ask permission from a primary care physician. And if that's what's important to you, then you would remain on Mary's side of the page, keeping original Medicare as your primary insurance, and then adding a drug plan, and then potentially adding a Medigap. So you're adding things to Medicare when you want Medicare to be your primary insurance. But you do have an option as a Medicare beneficiary to kind of replace, so to speak, Medicare with something else to be your primary insurance coverage. And that's the Medicare Part C plans, which are your Medicare Advantage plans, which is the yellow side of that page. If you did yellow to yellow, that's wrong. So we know with Medicare, you have that whole nation of physicians in hospitals and facilities. So if you decide that you don't want to use Medicare as your insurance carrier, but maybe replace it with a more local plan, like a Blue Cross or a Tufts or a Fallon, what do you think happens to your network of providers? It narrows down, exactly. Because when I say, okay, Medicare, I know I'm a Medicare beneficiary, and I know you're gonna continue to take that Part B premium out of my check, but then I know you're gonna take that premium and turn it around and give it to whatever provider I want to be my insurance carrier. I'm also letting go of that big nationwide network. So if I were just to pick maybe a Tufts HMO to be my insurance carrier, I have to see the doctors that have signed the contract with the Tufts Medicare HMO. Therefore, my network just went from the whole nation to really a much smaller network of maybe local physicians, hospitals, and facilities that have signed the contract with that Tufts Medicare HMO. So the biggest thing about selecting one of these is the knowledge that you're letting go of a big open network and you're moving into a smaller network. Not necessarily bad or good, but you just have to know that that's what you're doing when you elect one of these Medicare HMOs and Medicare PPOs. When you look at the companies that will sell you these products, basically the same companies that would have sold you a Medigap plan, right? You have the Blue Cross, you have Fallon, you have Tufts, you have Harvard Program on the back, and United Health Plan. So it's the same companies that would sell you both a Medigap if you wanted Mary's side, or a Medicare Advantage plan if you were looking more toward the Part Cs, which makes it confusing because a lot of people will call me or come into the office and I'll say, what do you have for insurance? And they'll tell me Medicare, because I know I'm a Medicare beneficiary, and I have TUPS. Okay, well, do you have this kind of TUPS, meaning it's a replacement plan and it's your primary insurance? Or was it a TUPS secondary, like Mary talked about? So you really have to understand what you have for coverage when you're dealing with all these companies that sell both products. So Medicare Advantage plans, it's all in one color because you're going to get your hospital coverage, your medical coverage, and your prescription coverage all wrapped into the one plan. So you always want to be sure when you're looking at all of these options that you're picking a plan that has the RX in the name. If you need prescription coverage, then you need to make sure you're picking a plan that has an RX in the name. Maybe I'm a veteran and I get all my medications through the VA. I really don't need to buy myself extra prescription coverage. Then I might be looking at the plans that don't have the RX because I don't need it. Those are the folks that might take one of these plans that don't have the RX. Everyone else should be picking the RX in the name. What's the big difference between an HMO and a PPO? So when you look down, you see, okay, I see Blue Cross, for instance, sells an HMO and they sell a PPO. What's the difference between the two? Can anyone tell me the difference between the two?
Don't go anywhere.
Go anywhere.
Anywhere and anyhow.
PPO is going to give you a little more flexibility,
Yeah.
and you don't have to use the referral system,
Yeah.
right? So we say the HMO is probably the most restrictive, because with an HMO, they're going to give you a list of physicians, a network of physicians, and you need to stay within that network. You need to ask for referrals to see specialists. And if you decided that you wanted to step out of that network to see someone else, it would be like you had no insurance at all. So they really are going to keep you within that network of providers. A PPO is almost going to give you like two networks. It's going to give you the network that they would like you to stay in, but they're also going to say, well, you know what, you can see other providers. You don't have to have the referral system. Your co-payment might be a little bit higher, but we're going to let you go and you're going to have the coverage. And let's go back to the word I just used, co-payment. With these plans, you're going to have a co-payment or some set amount of money that you need to pay for every service that's rendered to you. So it's not like the Medicare and the Medigap where you can have full coverage. This is almost, you can describe it as a pay-as-you-go. So not only are you paying the monthly premium, every time you go and have a service rendered, they're going to slide that window and they're going to be asking you for a set amount of money, usually paid up front. With Medicare, everything's paid on the back. With these plans, it's paid up on the front. So, when I'm looking at, when we look at those TUPS plans, and you notice the very first plan, that TUPS Saver RX, what is the monthly premium for that plan? Nothing. Zero. So, if they're not going to charge me any money to have this plan, and they're giving me hospital coverage and medical coverage and prescription coverage for no money at all every month, what do you think is going to happen when I actually have to go and use the plan? My co-payment's going to be high or low? It's going to be high, right? These companies want their money, and if they're not going to get it in a monthly premium, by golly, they're going to get it when you go and use the plan, right? So if we go down and look at the very last one, which is the TUPS Prime RX Plus, what do we notice the monthly premium is on that? It's $188.20. That's a pretty significant jump from zero. So would our co-payments be high or low on that plan? They would probably be pretty low, right? So when you're looking at these plans as options, and you're looking at the monthly premiums, they're all relative. So sometimes a lot of people will try to find one right in the middle. Co-payments then will be right in the middle. I have a lot of people that say, you know what, I'm really healthy. And I really only go to the doctor maybe once a year for my physical. So you know what, I'm going to take the gamble on the zero premium plan and pay nothing every month. Because I feel like I'm going to save myself a lot of money because I'm really not going to use the plan. It's a gamble because if you get sick, your co-payments are going to be high, but you're betting on your health on that one, right? So it's something to consider when you're looking at these plans. to look at when you're looking at these plans to decide if they're the right thing for you. And the first one is the network, like I talked about. You know, these, you can't go anywhere you want with these plans, you have to stay within networks. So if I was gonna pick that Fallon, you know, HMO, what would I wanna be sure of? My doctors have signed a contract with that Fallon plan, my specialists have signed a contract with that Fallon plan. If I was thinking that I might have surgery and had a skilled rehab stay coming up, I wanna make sure that the place I would wanna go to has signed a contract with that Fallon plan. So you wanna check those things out, that's number one. Number two, because my prescription coverage is included in this plan and I can't get it anywhere else, what would I wanna make sure of? They cover your medications, right. I don't wanna pick a plan and then they tell me that my $700 eye drop
Yeah, right,
is not covered, right? That would not do me any good.
yeah.
And the third piece of the pie, you want to be sure you understand the out-of-pocket expenses. You don't want any surprises. So if you're going to pick one of these plans, a Fallon plan for $46 a month, you want to know exactly what you're expected to pay when you go see your primary, when you go see your specialist. If you have to have an inpatient stay, you want to know what the your out-of-pocket expenses are. So, do you think these plans are most advantageous for the healthier person or the not so healthy person?
You could walk out the door and have an accident, and
Right.
you wouldn't be covered. You
Right,
wouldn't
we
be
can never predict the
You
future.
have-
We never know what's gonna
Yeah,
happen.
but if you have the higher plan of coverage, you're covered.
Right.
That's right.
You have a lot of people who like to,
Yeah.
fly by the seat of their pants though, right? And go with the flow. And you also know that you can change this plan every year during open enrollment. So if you figure, all right, I'm gonna take the gamble for 1 year, then reevaluate, because I know next year I can reevaluate and look at something different. Well, some people might take that option to potentially save considerable amount of money. So these plans exist. They're advantageous for some. The healthy person that, the contracts are in place, they might not take a lot of medications, they really feel like they're gonna save a lot of money keeping a low premium plan and not have a lot of out-of-pocket, but they're not for everybody. And as you age and we have more health issues, these plans really would start to fall apart for people, right? But they do exist, and you have to know that they're out there. So when you're talking to someone at the cafe and you're telling them that you pay $186 and change for your Blue Cross, and your friend says, well, that's great, I only pay $29. And you're like, what has happened? I am paying 86 and they are paying 29. You can guess that they have one of these plans and you are on Mary's side of the page where Medicare is your primary. Big difference between the two. Yes.
Do you know why Tufts Prime RX 154.40, why that didn't change? That's what we have.
Didn't change any of their premium prices.
No.
They
'cause
stayed the same right across the
They
board.
sent
didn't
us
have
a
any
notice
increase.
that they weren't changing.
They didn't.
That's
They
what I
changed
guess.
some of, so their premiums did not increase. But if you look into the details of the plans, there were small changes in the co-payments. So they did increase some of their co-payments. And that's where you'd have to look. You can't just look at a premium price because the premium stayed the same. But what they did is they went into the details of the plan and they increased some co-payments. So that's what you want to pay attention to all the time.
Well, we have a very good doctor, and he will not, he's a specialist, but he charges us $10, and he said that would never change, because we've been with him
Just
so
said it
long.
could change.
Yeah.
Well, he said it won't
He
change,
doesn't have to do that. That's
No.
something obviously he's
because
doing.
we've been with him for over 30 years.
But that generally does not happen for most people. So you do need to pay attention to all the changes that are going on in your plan, not just the premium change. Any questions on how these particular plans work? So very different from Mary's side, where you have original Medicare as your insurance carrier. These you're electing to have these private companies be your insurance carrier. So if one of these plans said, all right, I'm not gonna cover that, you can't go, oh, well, Medicare will. No, you let Medicare go. This is what you've got.
Can I ask about that medics, when you have the medics, you don't pay any co-pays, I guess.
Right.
And how about the hospital? Do they have, you know,
If
they'll
you have the bronze, then you don't have any co-payments.
in the hospital too?
Right.
Okay.
That's full coverage, that wraps right around Medicare.
Okay.
The other thing that I want to mention about these Medicare Advantage plans is that they can go above and beyond Medicare as far as coverage. So where Medicare doesn't cover some things like dental that we talked about, doesn't cover the routine physical that drives us crazy, doesn't talk about, Medicare doesn't cover your routine vision check, doesn't cover a lot of routine vision and hearing. Some of the things that we're all interested in. These plans oftentimes will. They'll give you a small dental benefit. They might give you a big discount on hearing aids. They might cover they'll all cover the routine physical. So these plans can go above and beyond the coverage of Medicare. So when you're looking at these plans, look at the things that they're covering above and beyond, because some of them you might find very beneficial. And they differ from plan to plan. So if your, physician group had a contract with the Blue Cross, but then again, they also signed the Fallon, take a look at the differences in what they're both offering, because you'll be surprised at some of the big differences that are going above and beyond Medicare.
One thing you get is extra, when you be in the group with the bronze, they'll reimburse you $150 if you're in a weight loss program,
A lot
or
of
if you're
them
at the
have.
Y, or an exercise program.
A lot of them are they're advocating for gym memberships.
$50.
Right. Some of them give you $150 back, some of them will cover an entire gym membership. Fallon is out there saying that they're gonna cover your entire gym membership, even if it was a $400 gym membership, they were gonna cover it for you. So that's what I mean when these plans can sometimes go above and beyond. Medicare is certainly not offering us any money to do anything like that, right? But these plans sometimes do, so pay attention to that.
I'm sorry, so just to back up a little bit, and I apologize, I hope I'm on here. So Medicare, like the Blue Cross wouldn't include a physical?
If it's a supplement, if Medicare is your primary,
It does.
Oh, okay, I'm sorry, I misunderstood.
Medicare,
Yeah,
you have original Medicare.
yeah,
They do not cover what we consider a routine annual physical. Medicare does not cover that. If Medicare doesn't cover it,
yep,
and you have a supplement, the supplement can't cover it because they can't go above Medicare. So if you have a service, you're on this side of the page,
yep.
and a service is rendered to you that Medicare does not cover, your Blue Cross cannot cover it either.
So even your supplement won't cover it?
No. So physicals get tricky, because if your physician actually codes that visit as an annual physical, Medicare will kick it out and not pay for it. So oftentimes you'll find physicians might code it a little differently as a visit, maybe you had high blood pressure or high cholesterol,
Yeah.
and they kind of code it as such, then it's usually fine, depending on how they code it, but if they should code it as an annual physical, it will kick right out.
Okay.
The only one the only folks that really cover that are the advantage plans.
And are any of the programs tied to your financial situation?
None of these are. These are all, these rates are set, so it doesn't matter on your health, it doesn't matter on your age, these rates are set, okay? We have assistance programs. We talk about Mass Health, we talk about unlimited income subsidy, we talk about prescription advantage. Those things are all based on income, assets sometimes, right? Assistance programs are always based on income and assets, both one, but these things are not based on your income, okay? All right, so one more piece of the puzzle that I want to explore with you is going back to the prescription coverage. So you have prescription coverage. You either have it through a standalone drug plan here, because you have Medicare as your prime, or you have it through one of those advantage plans where it's included in your coverage. But they do have something in common, and if you go to the light blue page, which is the third one in, light blue, yeah? Everyone with me? Okay. So I have to tell you about this thing called the coverage gap or the donut hole. Yeah, I know, we'll roll our eyes and oh no. Right, we need to know that it exists And we need to know how we get there, and we really need to know how we can avoid it. So what this paper talks about is the standard benefit. So it really doesn't matter how you have your drug coverage, whether it's a standalone plan or through your advantage plan, they all follow the standard benefit. So what the first box is telling you is that the rate for the deductible for next year, the highest it could be is $360. It went up. Last year it was this year. This year it was $320. It's going to go up to $360. So if your plan has a deductible, they can have a deductible set from 0 all the way up to $360. Be anywhere in between. The highest it can be is $360. So Mary, talk about it. If your plan has a deductible, odds are you're paying full price for your medications until you've spent the deductible amount, and then you get to go to co-payments. If a plan doesn't have a deductible, then the first time you go to the drugstore in January, you're just paying your co-payments. Okay? Now, some little game that they're all playing with us this year, they started it last year, and they're continuing this year, and they're saying, well, you know what? The plan has a $360 deductible. But if you just take those tier 1, tier 2 generic medications, we won't apply the deductible. So when you go to the pharmacy in January, we're going to give it to you for the nice little co-payment. But the minute you come and try to get a brand name, what's going to happen? That deductible is going to be applied, and you're going to pay full price for it. So you have to know that these games, that they're playing these games out there. When you're looking at plans and deductibles, Shine Council's going to tell you, okay, you're only on generic medication, so if you take this plan to Walmart, they're going to give it to you for nothing. But if you try to bring a brand name, get cataract surgery, and you go with that script for that eye drop, and it's a $500 eye drop, you're going to have to hit with that whole deductible of $360. So just be aware that the deductible game exists. Okay, so we have our plan, January, either it has a deductible or not, but we're going along, getting our medication. What's happening every time we pick up a medication? Can anyone guess what's happening?
Higher.
What's that?
I'm tired.
Your deductible's higher?
The medication.
The medication's higher. Because every time we go and we pick up a medication at the pharmacy, Medicare is in the background calculating the cost of the medication that we picked up kind of against us, so to speak, right? So I always use the inhaler as an example. When I go in January and pick up my inhaler, I might pay a $45 copayment, but the inhaler really costs $300. So when I go and pick up my inhaler, Medicare's in the background saying, okay, she picked it up, there's $300 against her. February, I do the same. I go with my $45, but Medicare's saying she did it again. Now I'm up to $600. By March, I'm up to $900. And when my cost back here that Medicare is telling me reaches $3,310, that's the number for next year, my cost. When that reaches that number, that's when I fall into the coverage gap. Okay? So by my one example of an inhaler, would I reach the coverage gap in a year? The cost is $300. October, let's multiply that by 10, I'm at $3,000. I'm just about there, right? So it doesn't take a lot of prescriptions to get me into that billing hole. It could take one expensive one.
So, I'm sorry, so what they're calculating is their cost.
The retail value.
Okay, so they're saying, oh, it's cost us, Medicare, X amount of money, that's what they're tracking.
Right, because your co-payment plus what the insurance company paid toward it
Yep.
is added together, and that's the retail cost. That's what Medicare is tracking, the cost of the medication. And that's something that we look at when we're doing these drug searches for people. We're looking, all right, who's got the best cost too, right? Because that all comes into play. And we'll look at, okay, these are your costs. It looks like you're going to fall into that coverage gap around this month. What are we going to do? We really want to try to find some protection when we fall into that coverage gap because we really don't want to pay the price. So let's talk about what happens when you fall into that coverage gap. The next box where it says coverage gap. I'm there with my inhaler, I go in November. Now I go in November to get my inhaler with my $45 copayment, and the pharmacist says to me, $45, you can put that away, because now you're responsible for 45% of the cost. If it's a brand name medication, and the cost of it. If it's a generic medication, I'm responsible for 58% of it. So all my nice little co-payments vanish, and now I'm stuck paying a percentage of the cost for the remainder of the year, just about. There is catastrophic coverage, which is the next box, but you have to out of pocket $4,850, which is a crazy amount of money. And what happens is for most people, the year ends and everyone starts back to zero in January. That's how the donut hole works when you hear people out there. And honestly, not a lot of us are paying attention to the cost of the medication. We're paying attention to what we have to hand over. That's important to us. But a lot of us aren't paying attention to cost. We have no idea what some of these medications cost. But Medicare's watching, and they're calculating, and they're waiting for us to get to that 3,010, and then that's going to put us in the coverage gap. Now, how many people in this room have heard of Prescription Advantage? Okay, I have a few hands.
Great.
It is great. Right?
Oops.
Someone thinks it's great.
But he didn't think it was so great.
Someone's looking scared. Okay, so let me talk to you about Prescription Advantage for a little bit. This is my last spiel here. So, Prescription Advantage is a state assistance program that is based on income, not assets. So you can have your 401ks, you can have your second vacation homes, you can have the assets, and Prescription Advantage is not going to be looking at them. Income only. So we have a lot more people that qualify for Prescription Advantage because they have their retirement sitting out there. And they might not qualify for Mass Health or any of the Mass Health programs that are looking for income and assets, but they might qualify for this. So I'm just going to give you a quick ceiling on this. So to have Prescription Advantage for free, if you were a single person, your gross monthly income could not be higher than $2,943. So if you're single and your gross monthly income is under the $2,943, then you could apply for this program and qualify for free. If you're married, they're going to combine your incomes together, and when you combine them, it cannot exceed $3,983. So when you combine your incomes together and it's under the $3,983, you can qualify for this program for free. That would be great. What does this program do? So what happens is if you can qualify for Prescription Advantage and you hit the coverage gap, the minute you hit the coverage gap, Prescription Advantage comes in and says, okay, Tracy, don't worry about that 45% of that inhaler. I'm just going to tell you that you can pay a small co-payment. Maybe it's $18, maybe it's $30, but it's not going to be 45% of cost. So you can relax. That's what Prescription Advantage is going to do if you hit the donut hole. So I have people that come to me and they say, well, you know what, I'm never going to hit the donut hole. I'm on Lisinopril. I'm on something generic that I pay really nothing for. I will never have costs of $3,000. What Prescription Advantage could do for you also is it allows you to change your plan one time outside of open enrollment. So if you came to me during open enrollment with your medication list, you checked your plan, you picked a plan, and then in the summer, the doctor puts you on this medication, and your plan doesn't cover it. Or the doctor puts you on this medication, and you go to fill it, and the co-payment is outrageous. You know, you could call me up and say, I want to change my plan. I have Prescription Advantage, I can do that. We would change your plan, and it would go into effect the next month. Same thing, what if you were on a Medicare Advantage plan? You know you're in a network, you're on a yellow plan and we're in a network, and you really want to go see a specialist in New York that you heard about. Your HMO won't let you go to a specialist in Boston that you really want to go to. Maybe they're trying to put you in a skilled nursing facility that you don't want to be in, you want to be in another one. If you told me you had Prescription Advantage, I could get you out of that plan by the next month. So that's one other benefit to Prescription Advantage by being a member. Once you're a member, you're pretty much always a member. This is not something that you have to reapply for year after year. Every once in a while, every few years, they might send you a letter just to verify your income. If you ignore them, then they will drop you. But if you send them a letter back and say, yes, my income's the same, then you will continue to always have this. So it is a great piece of information to have in your back pocket. Now, Prescription Advantage always also has a higher income bracket category. This category, when they end up charging you $200 to be a member. And it doesn't come in and help you right away when you hit the donut hole. It waits until you've out-of-pocketed $3,500. So that is not for everybody. So if you applied for Prescription Advantage and they told you that you were going to be an X5 and they were looking for $200, you could call us, you could talk to Wendy and say, is this really worth it? And we would tell you whether it would be worth it or not. And then you could just tell Prescription Advantage, no thank you, I decided against it. So if it's free, everyone in this room should have it. Because even if you don't hit the donor hole, there might come a day when you want to change plans. And you can with Prescription Advantage. So there's 3 ways to apply for Prescription Advantage. There's the paper applications, which they all have here in this office. You can call Prescription Advantage directly and enroll over the phone. And you can also go to their website and enroll online.
I have to interrupt.
So are there any questions with regards to anything that Mary and I talked about today?
This is for a single person.
For free? Okay, for a single person, again, you couldn't have a gross monthly income higher than $2,943. $2,943. That's a month, which comes to about $35,000 a year, a little over $35,000.
I have COA plan for Blue Cross Blue Shield.
Yeah.
When I got notification just a while ago about changing premiums, it was a middle. There was core and bronze. And there was some, okay, for like $136. What
A
is
choice is
that?
kind of a hybrid. Blue Cross loves to make our job difficult this year.
I
It's
just
kind of
wondered
a
if it would
hybrid
be
between the
beneficial.
2 plans.
Mhm.
So with your core, when Medicare is your primary insurance, that allows you to go anywhere, and the core just follows you anywhere in the country. With this choice plan, they are going to give you a bit of a network. So you do kind of lose the flexibility to go wherever you want. And so if you're really looking for more details on the plan, I would call Blue Cross directly because they'll tell you exactly how that network goes, but they consider it a hybrid.
And I've had the court for several years and gambling that I'm healthy and won't have to go to the hospital. And I was told that if I did have to have, say it's now the 20th or whatever, and I had to go to the hospital for some extended time, I could call Blue Cross and change my plan to bronze, and I would be covered for bronze for that next month. That is correct?
So let me just reiterate what you said.
Okay.
Yes. When you have a Medigap, so if you were on Mary's side of the page where Medicare is your primary and you bought a Medigap, whether it's a core or a supplement 1, those are not subject to Medicare's open enrollment, like all those yellow plans are and like our drug plans are. Those are not. Therefore, you can change those anytime throughout the year. So exactly right. If I have the core, but my health changes, or I can anticipate something, and I want to increase to that higher coverage, I would call Blue Cross, and it would go into effect the first of the following month that I call. Nothing can change in the middle of the month. If I fell out in the parking lot, that's it. But I could change it for the first, even if I call the last day of a month, it will be in effect the next day, but always on the first. So you can do that any time throughout the year. Those many Great question. Thank you. Any other questions?
Yeah, I want to ask you about, when you took that separate, we'll say that, as I say, you have the other prescriptions, okay? We'll say you're paying like $45. All of a sudden, the doctor changed your medication to maybe a tier 3, a tier 2. Now, is that 45 included in that, the prescription? You know what I mean?
45 for what? The premium?
Yeah, how they give you a certain amount which you have for your prescription, let's say the $45. Is that included, supposing you change it now to a tier?
Well, every tier has a different copay.
Right, right.
The lower the tier, the lower the copay.
Right, I
So if I from a 2 to a 3, then that co-payment is gonna increase.
Yeah, but I mean, but when that's separate, we'll say, you're not gonna have the 45, it's gonna be a tier 2 now, or we lower.
So you
Then
pay
it
less.
would be lower.
Oh, yeah, sorry, right,
Then
okay.
change tiers, which they do from year to year.
Yes,
And
right.
you'll see a change in your co-payments.
Okay.
Yep. Anything else? Okay, we have a room full of Medicare
got another
experts
question.
today. We're good.
Yes, you know, I was like, what's this thing on TV now? Medicare's offering dental? What's cooking with that? I need a dental plan. Is that legal?
I don't know, I had not seen the commercial. I will tell you, Medicare does not cover dental. If you are on a Medicare Advantage plan, one of those HMOs and PPOs, they may have a dental included in it. Or you are buying a separate dental policy. Now, Blue Cross sells dental policies, they're in the dental business, just like, what are some big dental, Delta Dental, right? They're in, any of the major dental companies, even that you may have had when you were working, you can just go and buy a private policy, which is generally what Medicare beneficiaries might do. The other thing that Medicare beneficiaries might take advantage of is, one of the community health centers. We have a new community health center that opened in Plymouth at Cordage Park that has dental. And you don't have to be a medical patient to take advantage of their dental. And it's a significant discount on the prices, almost 50 cents on the dollar. So if you're just looking to have your 2 cleanings and maybe your x-ray and you're really not you're not married to the dentist that you've been going to see, you may want to consider going to the community health center in Plymouth because they're really going to give you, if you're paying cash, a significant discount on the rates. So we tell Medicare beneficiaries that don't have dental insurance, might be something to check out for a low
Any place around here? Rather than
Plymouth and Brockton has a community health center, but I believe you have to be a medical patient there also, where Plymouth,
I'm sorry.
Brockton Community Health Center, Brockton, it's in Brockton, I don't know the official name of it. But there is a community health center in Brockton, but I believe you have to be a medical patient there in order to take advantage of the dental, where Plymouth can be separate, which is nice. Any other questions? All right, well, thank you very much for coming, and Wendy, is there anything else that you want to say?
If you haven't signed in, if you could just please sign in over here before you leave, so I know that, Jill is here. Thank you. Oh, if you need an appointment, if you want to do an individualized drug search, just call myself or Fran, and we'll set up appointments between now and December 7th, so we can find the best plan for you. Okay?
Thank you.
Thank you very much for coming.